Today I'm going to be simulating a dental appliance cleaning on a live patient. My setup includes several paper towels, which is in central sterile sink, 2 Ziploc baggies, tartar and stain remover, denture bath, which is filled with mouth rinse, a denture brush, a tray with a white napkin, 2 pairs of disposable gloves, and utility gloves, which are also in central sterile. Hi Savannah, so my name's Jessie and I'm going to be taking care of your appliance cleaning today. Do you have any problems with your appliance as of right now? Any sore areas that it might be rubbing in your mouth?
No.
Any cracks, chips, broken areas on the appliance that you're aware of?
No, it's in good shape.
Okay, and do you take it out every single night when you go to bed?
I do take it out and I put it in a denture soak.
Okay, good. So I'm just going to have you go ahead and remove your appliance,
Okay.
and I'm going to go and inspect it to make sure everything's good to go with it.
Okay.
Thank you. And now I'm going to rinse the gross debris off of the appliance. And now I'm going to inspect to make sure that there's no cracks, damage to it prior to doing treatment on it, or any home repairs, and it looks to be good. If there were any damage to it, cracks, I would notify the patient to let them know before we continue on with treatment. Now I'm going to place the appliance in the denture bath so that I can transport it safely to central sterile. So I removed my disposable gloves so that I can carry the tray into central sterile. So now I'm going to be filling the sink up with 1 to 2 inches of water. Inside the sink I have 2 Ziploc baggies, one inside of the other. The inside bag I'm only going to be touching with my disposable gloves, and the outside bag I'm only going to be touching with my utility gloves. So now I'm going to be adding tartar and stain remover into the inside bag, and that's going to be mixed in with enough water to cover the appliance, warm water. So now I'm going to remove my dental appliance from the denture bath. I'm going to place it inside the inside baggie with the tartar and stain cleaner and water. I'm going to seal this bag, inside bag, with my disposable gloves. Now I'm going to remove my disposable gloves. Don my utility gloves. Now I'm going to close the outside bag. Okay. So now I'm going to place the baggies inside of the ultrasonic for 10 minutes. For heavier soiling, stains, and calculus, it'll stand for at least 15 minutes. Now I'm going to go back to my patient and continue with EO-IO and treatment. So now we're going to be discussing the proper care of your appliance at home. So you said you take it out every single night. Just make sure when you take it out at night that you're going to be soaking it in an actual denture bath with proper cleaner such as Polydent, and you can buy that on Amazon, at Walmart or Walgreens. Just make sure that after every meal you take your appliance out and you lightly brush it and rinse it with water, and make sure that you where your denture actually rests in your mouth, make sure you're massaging that each day with a soft toothbrush, so just lightly brush over it.
Okay.
So now I'm going to remove the appliance and the baggies from the ultrasonic. I'm going to place it in the sink. I'm going to open the outside bag, making sure that I'm not touching the inside bag. Now I'm going to remove the appliance from the inside bag using my disposable gloves. I'm going to look at it and inspect it. If there were any more leftover or residual calculus or stain, I would then notify my faculty to come over and assist me to remove it with the brush and you would not use a curette to remove any type of calculus off of the appliance. So now I'm going to place it in the denture bath and transport that back to my unit. Okay, now that treatment is completed, I'm going to receive the appliance out of the denture bath, rinse it with water so that I can return it to my patient. There's your appliance, ma'am.
Thank you.
Now I'm going to be disinfecting the denture bath with 50-50 bleach and hot water.